All right. Good morning, professors, friends, and other participants today. My name is Lerkchai Trakulmukthong, and I'm a student of Faculty of Dentistry of Rangsit University. I would like to present to you our research, Fluorescent intraoral camera as a new method to motivate oral hygiene. These are the contents that we will be going through today. One of the essential duties for dental practitioners is to help prevent diseases and maintain oral health through the means of educating and providing their patients the capability to do so. Oral health motivation is the key for building a positive attitude, which results in an oral caring behavior. Conventional plaque staining erythrocin method has long been a way for dental practitioners to try to evaluate the patients and educate them of their oral health status. The emergence of fluorescent intraoral camera opens up the opportunities for dental practitioners to try out a more convenient method of patient education. The new technology has several advantages over the antecedent method, such as being allergy-free, lesser to no compliance regarding coloration, unpleasant odor or taste, and having the ability to distinguish older enamel plaques. The comparison of the ability to motivate the patients between the two methods has been of our interest. Hence, it has become the topic of our research. Excuse me. Dental plaque is a community of microorganisms accumulated as biofilms which are found on the tooth surface. There are primarily two methods of dental plaque detection: the conventional erythrocin disclosing agent method and the fluorescent intraoral camera method, trademarked as SuperCare, as this is the brand that we use in our research. Another aspect of our research is motivation. In this case, the motivation to carry out tooth cleansing behavior. Cook et al. Proposed 4 key concepts of motivation and defined it as the process whereby a goal-directed activities are instigated and sustained. Now, what's the importance of motivation? Periodontal health is strongly dependent on one's oral health behavior. The change in oral hygiene behavior requires not only basic oral health knowledge, but has also been shown to depend heavily on the more complex psychological processes. The objective of our research was to determine whether the newly introduced fluorescent intraoral camera can motivate patients to practice oral hygiene better than the traditional dental plaque disclosing solution. And these are our inclusion criteria for our study. And these are the exclusion criteria for our study. The statistical analysis, the self-perceived oral health and habit in each group within the group, and plaque and gingival indices in each group were analyzed using paired t-test. On the other hand, the self-perceived oral health and habits between the two groups, the plaque and gingival indices between the two groups, and the motivation level between the two groups were analyzed using Mann-Whitney U test. The materials required for our research comprises of standard dental equipment, dental unit, mouth mirror, air water syringe, dental explorer, erythrocin disclosing dye, SuperCare device, and scaling set, and the questionnaire. This is the study procedure of our research. The study procedures follows the following diagram. The subjects were to be given a pre-test on the self-perceived oral health habits before getting divided into two groups. They received gingival index assessment and plaque staining to record a baseline plaque index. One group was shown staining and given oral hygiene instructions. For another group, their plaque was scanned with the SuperCare fluorescent intraoral camera and shown images from the intraoral scanner while being taught the same oral health instructions. All subjects then receive partial scaling on 7 teeth, which are teeth 16, 12, 24, 36, 32, and 44. 6 teeth. 6 teeth. Excuse me. The subjects were to be recalled for 2 weeks after the scaling and the initial meetup for the final re-evaluation of their gingival and plaque indices. They were shown plaque with respective methods, same as before. Also, they were given oral hygiene instruction. The oral hygiene instruction was given to the subject were through a video lecture, which was 5 minutes long and consists of the modified bath brushing technique and using a floss. The post-test to evaluate the self-perceived oral health and habits motivation level were done on this visit. Moving on to the questionnaires itself, the questionnaires were divided into 3 parts. They consist of the general data of the subjects, self-perceived oral health and habits, and the motivation level. Part 1 and Part 2 were done on both visits. And the last part, the motivation level, was done only on the recall visit. For the results, 52 subjects were recruited for the study. 4 of them dropped out during the study, leaving us with only 23 left in the erythrocene group and 25 left in the SoProCare group. Subject ages between the 2 groups were not statistically significant difference. The distribution of gender between the groups are similarly distributed. The mean self-perceived oral health and habits, or SP for short, of erythrocene group saw a slight increase, while the mean SP for SoProCare group saw a small decline. Subjects in both groups felt positively motivated. The average scores are as seen on the table. The mean plaque index of both groups saw a decrease in the recall visit. The decrease was, however, not statistically significant. The mean gingival index of erythrocene group rose, while the SoProCare saw a drop in numbers. However, the changes were not statistically significant. When comparing within both groups, plaque index and gingival index of SoProCare groups decreased with a statistical significance, while the decrease in erythrocene group was not statistically significant. Motivation is defined as the revitalization of behavior to achieve a goal. Sarasoli et al. Stated in the year 2014 before raising 2 types of motivation, intrinsic and extrinsic motivation. With the right internal push, individuals with an intrinsically motivated pattern will be more interested in performing a thing on their own, and that includes oral health motivation. The dentist's oral health motivation push results in extrinsic and intrinsic motivation. Thus, motivation is a significant key element for the patient to adopt healthy oral habits and ultimately improve their oral health. From our literature review, we found out that the motivation is mentioned in many studies aiming to change oral health related behaviors and clinical outcomes. It is also effective in the prevailing health education strategy in eliciting positive changes in patients' oral health behaviors, especially in young and adolescent patient groups. It takes repeating and continuous action for the motivation to become concrete. According to Soto et al., the consistency of action is key to prevent possible decline in performing oral hygiene measures and its results. Thus, a dental visit ideally requires several follow-ups to keep motivating and reinforcing patients' good behavior. And just like Soto's study, all quantifications of something subjective, such as motivation, is measured by using something more tangible, which are the plaque and the gingival indices. The study aimed to determine the difference in oral health motivation between the stated erythrocin disclosing agent group and another group with fluorescent intraoral camera. From the results, the two groups showed no significant difference in regard of oral hygiene motivation. The group with intraoral camera, however, saw a significant decrease in gingival and plaque indices. On the other hand, the erythrocin disclosing agent group also saw a decrease in both indices, but was not of any statistical significance. Video instruction was used in our research as a means to provide oral health knowledge and instruction, since Siebels et al. In 2018 found out that this method is as effective as one-on-one instruction method. Lins and Rock also stated that even in patients with fixed appliances, oral hygiene instruction method is taught could also help reduce the plaque and gingival indexes. Mackin and Johnson, and later on Fields and Pinkham, found out that using video instruction in dental situation has proven effective for improving the attitude of young patients. Also, the younger patients are of interest in our study and were recruited. Therefore, the video instruction method was chosen in our study. Araujo et al. Found out in his 2019 research that patients who were shown photos of their own teeth who were taken, had a high increase in both toothbrushing and flossing. As mentioned by McCann Johnson study, the changes on oral hygiene behaviors are highly associated with visual technologies, which reinforce the impact of learning and behavior of the younger patients.
3 minutes left.
In addition, intraoral camera has several advantages in terms of data collection and detecting more details such as old plaque and new plaque. Gingival, giving oral hygiene instruction and showing images via intraoral camera could be a more beneficial when comparing plaque pictures between patient visits. The study has some limitations since most of our recruited subjects were young adults with mild gingivitis with mild and moderate plaque accumulation, which may not reflect the general population that has more severe forms of gingival diseases. A study with a more varied age groups, we see a more varied different result in the results. And lastly, the conclusion. As for our conclusion, oral hygiene motivation is important and should always be encouraged to patients for good oral health in the long run. Both techniques that were utilized in the study were tested to have the ability to provide such motivation. However, the intraoral camera demonstrated patients a clearer and easier comprehension of their own oral health over the conventional method. Moreover, the additional benefits of the intraoral camera, being the digital format of data collection and the ability to disclose plaque thoroughly, may instigate a newer trend in oral hygiene motivation that could be explored further upon. And these are our references. We would like to thank you, our advisor, Professor Jananya Pelangsi, and these are our group members. And we'd like to thank you for your attention.
Thank you so much, Mr. Lerkchai, for your presentation. So this is the final topic on the morning session. Is there any question from the audience? Well, I have some questions, Mr. Lerkchai. You said that the objective of the study is the key factor is about the motivation, right?
Yes.
Okay. So could you please explain how do you measure motivation in your study?
It's like from our literature review and so basically motivation is something subjective, right? And so motivation in our research is measured by comparing the gingival and plaque indices of the patients, because because in our literature review, we found out that motivation leads to the actions, and actions, the oral caring actions would lead to a better indices in both aspects. So motivation is measured using the gingival and plaque index in our study.
So it's like it implies that if the result of the oral hygiene is improved, so that means that the motivation might have been better than before, right?
Yes,
Okay.
and we also measured the motivation level and the self-perceived oral health and habits too.
I see. And from your literature review, is there any other instrument to measure motivation more than this? This is like an indirect way to measure motivation, right? And does they have any the questionnaire or anything to measure motivation of the patient?
Yes, it is. It is also another thing that we do in the research is that we also measure, basically the questionnaire asks like how the patient feels toward oral health behaviors. So we ask the subjectivity, how the patients feel. So which excuse me, like apart from measuring something like the index, we ask how the patient feels. So that's another way of measuring motivation. So basically how the patient feels and their what they perceive from the instruction and all the videos and the motivation that we gave them. Yes.
I see. And from that part that you mentioned about the feel toward the oral hygiene condition, is there any difference between two groups?
The feel, I mean, actually there is no big difference. Like this difference is not statistically significant between the two groups in this regard.
So their attitude toward the oral hygiene is not different at the beginning point, and so you compare the gingival index and the plaque index, right?
Yes, but the results are the result improved.
Okay, well then the last question is from your study, what is your plan to do next from your result? What would you like to do with the result to further study or anything else?
Mainly from the results of our research. I mean, the main focus, the main interest of our research is the intraoral camera. So, I mean, from the results, we found out that the gingival and plaque indices decrease with a significance when the patients were shown the pictures with the intraoral camera. So with that, we kind of want to investigate further, like how did the intraoral camera was able to make the gingival and plaque index decrease more than the conventional method. And also, like I said in the conclusion, that the intraoral camera has several advantages. So maybe there are other ways and to make the most out of the technology.
Okay, thank you so much.